Hello everyone, I'm Doreen and I'm from Saugerties, New York, and I'm a fellow LYME, as you all out there. And if I was told 5 years ago that I'd be speaking about Lyme disease on the lawn of the Capitol building, I would tell you you're probably crazy, but here I am. And I'm here to speak for my friend. Her name is Kristen, and unfortunately Kristen is too ill to come and speak for herself this afternoon. She got sick a couple days ago and ended up in the ER. And so I'm going to try to read her speech. And I'd like to tell you a little bit about Kristen. She has a master's degree in humanistic and multicultural education from SUNY New Paltz and a BA from PACE, where she majored in international management and minored in international marketing and Spanish. And Kristen teaches Spanish at the Pine Bush High School. And so I'm going to try to read this like she's reading it. Wish me luck. She says, "Good afternoon. My name is Kristen Roche, and I am no one, and I am everyone with Lyme. I've been asked to speak to you today about the critical need for health insurance reform with regards to countless number of patients, Lyme patients, who are receiving insufficient treatment, or even worse, they are receiving no treatment at all. In order to do this effectively, it is important that we become friends. So you see, I'm going to share some personal information with you. So I am doing this for myself and as for you also." She goes on to say how when she was 47 years old, she thought she was going to end up in a nursing home to die. She said the parasites partying in her temple. She had been bitten 2 times by a tick. And where were all the people who were supposed to be protecting my health, she said, holding information from me, valuable information. Oddly enough, this journey began on a festive occasion, a birthday, November of 2012. She says, "As I lay in bed, I searched for fevers online with possible causes. Lyme kept coming up. She had been bitten twice in October, but the ticks were not engorged. I had even seen my doctor. My knee had been bothering me, my back had ached, and I had just figured that there was nothing wrong. I had just minorly injured myself. The next day, I saw my primary doctor and asked if she would please test me for Lyme. And I was reminded how to utilize the internet because some people don't know everything. I assured her that I just wanted to rule out that it wasn't Lyme. Please do the test. It came back positive in 2 days, and I was told that the medicine would take care of this. Hence, I began a 3-week regimen of doxycycline. I learned about herxing, which is an increase in symptoms caused by the toxins released as the Lyme-causing bacteria die. A few days before Christmas, I told my husband, I feel like I'm going to die. And he said, it was the doxy, you'll be okay. And gradually improvement came. And as I was ready to get back into business at school, with midterms right around the corner, I took my last pill on January 4th, and I felt great for about 5 days. It soon became apparent that there was a problem. The fatigue was creeping up, and as well as an odd sense of something was just terribly wrong. Within 2 weeks, I was not only experiencing symptoms prior to doxy, but even more alarming ones. I had slurred speech, I couldn't remember the students' names, and I had a lot of trouble coming up with words. I had pain that increased so badly, it was intolerable. I had to find a Lyme-literate doctor, or I would be doomed. Luckily, a friend had told me about such a doctor, and I made a life-altering appointment on January 14th. Why was I only treated for 3 weeks? Why was I not tested for co-infections? I was indeed very sick and put back on doxy for 2 weeks in order to satisfy my insurance company. And then I would need a PICC line for IV antibiotics. My insurance company would probably not pay. And that's what the doctor said. And I said, really? I find that hard to comprehend. I returned on January 28th. My symptoms were intensifying. To my great relief, my physician put in a request for a PICC line, the necessary medication, Rocephin. He stated that I would have the PICC line in by February 1st, and I did get it in by February 14th, after I had been denied 4 times by my insurance company. I contacted my state assemblyman and senator. I emailed U.S. Senator for a week straight. I sent a letter of my appeal to the state attorney general's office. I did not give up. It was my battle, and a lonely one at that. Due to my illness, one email would take me about 2.5 hours to write, yet I persevered. I also changed my way of thinking. After I was denied the 3rd time, I told my physician that they are messing with the wrong person. Now I'm angry. And that's just me. It's about those people who do not have the strength or the resources or the ability to fight. I want to fight for them. I am lucky. I have a computer, a fax, and a decent educational background. Learning how common the lack of treatment became very alarming. Connecticut has a law stating that physicians will determine the course of care for Lyme patients, not insurance companies. Currently, New York has a bill, S3478, which is being considered by the Health Committee, sponsored by Senator Gibson. It is similar to Connecticut law and is critically needed. So many people receive a denial and just give up, and this is very disheartening. When I had almost completed the 28-day doses of Rocephin, my physician told me that I was going to need more medication, and I was still suffering from too many symptoms. My insurance company would not approve another round of medication. So I wrote an appeal, and another, and I continued to write Governor Cuomo, Senator Schumer, President Obama, heck, I even wrote Oprah. And I told them that the insurance companies were misconstruing CDC guidelines and regulations to the Lyme County Departments of Health in order to deny treatment. In early April, Steve Israel, a reporter for a local newspaper, interviewed me, and the paper had done a story about Lyme in March, and I had pointed out to him that those people were denied treatment also. And he stated, "We missed that real story." He was astounded to what I have had to do in order to receive this life-saving treatment for potentially fatal disease. Yet the saga continues. Currently, I've been denied 5 times, and for my 2nd round of medication. Thus far, I have purchased some doses on my own, and so has my sister purchased some for me. My colleagues at school have collected enough money to purchase a month's worth of medicine. I am also on 2 different other antibiotics, roughly 40 pills and supplements a day. I will get better, and I will help others with Lyme. The first time I was denied, I was told that I did not have it, since I did not have 5 positive bands. And although I had concurrent positive tests, I was still told I did not have Lyme. When my 2nd round of medicine was denied, I was told long-term antibiotics was not medically necessary for Lyme. And I told them, "You said I didn't have Lyme." Really? When I discussed the situation with the administrator of the school's health insurance policies, she gave me a question to ask. If you are not going to improve with Rocephin that my doctor has prescribed, what will you give me instead? And I am still ill. What do you suppose I should take? And she said, "That will be up to your doctor." And I replied, "My doctor wants me on Rocephin." 2 weeks ago, I faxed an external appeal to the New York Department of Financial Services, and I am very grateful for the support that I have received from my family and friends. I have a new perspective on life. I no longer need to be the only one who keeps things going or looking for the approval. I have heard no frequently, and now it does not deter me. I have had the pleasure of working with a young woman with Lyme whose daughter has been already affected with Lyme. I keep asking questions and looking for possible solutions. My goal is to set up training for former patients who provide catheter care for current patients. This training would assist those being denied service or even without insurance. Getting Lyme was not in my plans. It was, however, crucial to my growth and was certainly made more beautiful. Today, my friends, you will choose how to see yourself. You will be the victim of the system or a part of the change. I refuse to see myself as a victim. I will focus on the positive in order to bring change about. Doctors are curing their patients, and they must be protected. We must come together to truly be effective. Many small raindrops make a quiet storm, and I am in this for the long haul. I hope you will accompany me. Please join a local support group, get involved on Facebook, set up a table at your local farmer's market, talk with your friends and family, write your politicians, and lend a hand to those who are in need. Yes, those with Lyme who are unable to be with us today, visit them, sit with them, talk with them, make them feel like they're not in isolation. And together, we will make a difference. And those are the words of Kristen Riucci. And she also wrote a poem, and she wants me to share this with you. She says, please indulge me as I read a poem I wrote as reflected on the whole situation. It's called That Ain't Right. And the poem is about the current situation of Lyme disease. It's inspired by Chris Rock's character in Head of State. And here we go. People are not being aware of the dangers of Lyme and co-infections. That ain't right. People are not being tested properly. It's unreliable. There's too many false negatives. And that ain't right. People have been misdiagnosed with MS, ALS, fibromyalgia, and ADD, when actually they have Lyme or co-infection due to the ignorance on the part of the medical community. And that ain't right. Insurance companies are misconstruing the CDC regulations regarding reporting Lyme to the county health departments and using it in order to deny coverage. And that ain't right. Sick people are losing friends, their dignity, and the ability to support their family due to the society's ignorance and their trust in insurance companies. And that ain't right. Company CDC guidelines have been established by small groups of doctors, eliminating participation of doctors who utilize long-term IV antibiotics, and that ain't right. Our society is at great risk, and should this be present situation continue status quo, it's just not right. And you know what? She wanted me to curse at this next one, but I'm going to bleep it out. She said, in big letters, that's just not right. I block it out for you. And at this time, we should really try to join together and correct all the wrongs and come up with a viable solution. So that's the letter from Kristen, and I'm really sorry that she couldn't be here today. And on a personal note, I would like to say thank you to Dr. Bach, because this man saved my life, and I'm very grateful to him for that. And for those of you who might still be in search of some answers, or you know someone who needs to find out more information about the real Lyme situation, you can visit a webpage that I put together. It doesn't cost anything. No one's going to ask you to buy something. It's all free. It's just that I've dedicated a lot of my time to try to educate as many people as possible about this horrific disease. So if you'd like to go to www.lymediseaseandyou.com, you might find out a few things that you don't already know. Thank you so much.